Welcome, future educators. I am so glad you're here. Today, I'm stepping in as your instructional coach to help you tackle Competency 003A and connect it directly to your future classroom practice. Whether you're prepping for your certification exam right now, or you're just looking ahead to the incredible responsibility of leading your own classroom, this explainer is totally designed for you. We're not just going to sit here and read through standards today. We are going to unpack the content, learn the terminology, and most importantly, visualize exactly what this looks like when you are standing in front of your very own students. Let's get to it.
All right, let's jump right into part one, the classroom moment, taking theory straight to practice. Before we even peek at the standard itself, I want you to ask yourself, why should you, a future teacher, care about health behaviors? Like, why does it matter what a kid does on the playground or at the dinner table when you're just trying to teach them reading or fractions? Well, because you are teaching the whole child. Their physical state literally sets the stage for their cognitive state. Picture this. You're looking out at your third graders first thing in the morning. Some are bright-eyed and ready to go, while others, well, they look like they might just use their math workbook as a pillow. Their ability to learn is fundamentally tied to the choices they made before they even stepped foot in your room. Did they sleep enough? Did they eat a decent breakfast? Are they washing their hands so they don't catch that bug going around? These are health-related behaviors. And figuring out how these personal choices impact their body systems and overall health is exactly what this competency is all about. So, moving on to part two, let's actually define Competency 003A and look at the course standard. The standard states that a beginning teacher understands health-related behaviors, ways that personal health decisions and behaviors affect body systems and health, and strategies for reducing health risks and enhancing wellness throughout the lifespan. Now, grab onto that last phrase, throughout the lifespan. It is absolutely huge. You are helping students see that the habits they build right now as kids can literally shape their wellness for decades to come. And that brings us to the core philosophy here. You aren't just rattling off isolated facts, you're actively shaping habits. If this were just about facts, you just have them memorize bone names or point to a food pyramid. But the exam standard and frankly good teaching demands more. You are developing their decision-making skills. So instead of just pointing to a brain on a poster, you're explaining how staying up late playing video games directly impacts their nervous system and their ability to focus the next day. You're connecting the what to the why so they can make better choices. A crucial piece of this puzzle is the concept of wellness. And wellness goes way beyond just not being sick. It's a complete state of physical, mental, emotional, and social well-being. Think about it. A student might not have a fever, but if they're struggling to regulate their emotions or having a hard time making friends, their wellness is absolutely compromised. As an educator, you've got to look at health through this much broader, holistic lens. Now, to ace this exam and actually talk the talk in your professional learning communities, we need to lock down some academic language. First up, health-related behaviors. These are just the everyday actions people take. Then, body systems, how our organs work together, like the digestive or respiratory systems. You also need to know how to tackle a health risk, which is anything that bumps up the chance of illness or injury. And finally, preventative health behaviors, the proactive things we do to stop sickness before it starts, across our entire lifespan. Get comfortable with these terms? They are absolute game changers.
All right, part three, theory into practice. Let's take this straight into the classroom.
Let's head back to that third grade scenario and map out a concrete lesson on sleep habits. This is where the magic happens. It's your job to take this kind of abstract idea of health behaviors and make it click for an 8-year-old. So you design a lesson that bridges the gap between what they do at home, what happens inside their bodies, and how well they can concentrate while sitting at their desk.
Check out the flow of this instruction. Step 1, you teach the mechanics. They learn how getting enough sleep literally repairs their nervous system and helps them grow and recover. Step 2, you make it relevant. You connect it to their daily reality, showing them the direct link between sleep and their ability to crush today's math lesson. And then, step 3, you empower them. You have them set a personal, realistic goal for their bedtime routine. Boom, you just turned a textbook fact into an actionable, lifelong skill. I want to pause here for a second and throw a question your way. As a future educator, how could this strategy support the diverse learners in your room? Think about it. Some of your kids might share a bedroom with 3 siblings, or maybe their parents work the night shift. You have to guide them to set goals that are actually realistic and respectful of their unique home environments. Actually, that level of reflection, that's exactly what's going to make you an incredibly empathetic and effective teacher. Which brings us to part 4, exam takeaways and beyond.
Let's lock in the top 3 things you need to remember for your certification exam. Number 1, health behaviors directly affect body systems and overall wellness. It's an interconnected web. Number 2, prevention is the name of the game in health education. We aren't just reacting when things go wrong, we're building proactive habits. And number 3, the ultimate goal is equipping students with lifelong habits that reduce health risks. You aren't just teaching them for the 9 months they're in your room, you're setting them up for their entire lifespan.
Because ultimately, the habits you help forge in your classroom are going to ripple out for years to come. When you help a child connect the dots between their daily choices and their own well-being, you are doing profound, life-changing work. So, my final question for you: what will it look like when you are empowering your own students to make choices today that help them thrive tomorrow? Keep that in mind as you prep for your exam, and best of luck as you get ready to make a massive impact.